Hi everyone, and you're welcome to Healing Minds with Boma. I am Boma, and today I just want to answer some questions, okay, that people normally battle with. The question is, who needs therapy? Okay, at what point in our life do we think that we need therapy, and who can benefit from therapy? Now the question is that a lot of times we do need therapy more than we think we do, and we can all benefit from therapy one way or the other. However, some people may need therapy more, or they may need it even urgently due to some emotional, psychological, and mental or behavioral reasons. Now, for mental health disorder, there are the severity levels, okay? And so some may start as an everyday minor challenge, and if left unattended to can aggravate to what we call the full remission, where a lot of times goes with medications and therapy. Okay, so now the question, who needs therapy, is number one, people experiencing mental health symptoms. And these mental health symptoms, I'm not saying that it's a diagnose, all right, I'm just saying symptoms that may lead to a mental health disorder. Okay, a lot of times we normally just put it in a question mark, suspected symptoms to a certain mental health disorder. And so this could be people experiencing general mental health symptoms like persistent sadness, anxiety, anger, mood swings, and all of that. And people also having panic attacks or chronic worrying. You always worrying about something, can't sleep, you have sleepless nights, or the trouble maintaining sleep or eating well, or losing weight or gaining so much weight, all of these may mean that you need some talk therapy and deeper into clinical therapy. Okay, now number two is those that are facing transitions or stress. There are people who may have gotten a new job and they are leaving their state, or they are region to a different state or region, and so adjusting may be a problem. Some people find it very hard to be flexible or adaptable, and so they may need what, therapy to help them adjust to the current life struggles. Those going through divorce, like breakups, heartbreaks, grief, and relocation, you may all need therapy because you need the ability to cope with this positively, especially those going through divorce or losing somebody, a friend, a work colleague, a family member, somebody that you know, and all of that. You need therapy to help you cope. Now, career change or job loss, we all know how economy these days is so bad, and you can imagine losing your job. It will be so hard for you, so you may need therapy to help you cope with that. Becoming a parent or empty nesting, it's not easy. People don't talk about parenting. I mean, it's really, I don't want to say it's a scam, but people hardly talk about becoming a parent. And when we talk about postpartum depression disorder, my goodness, I have had a client like that, and to myself, I was really shocked at it. I was like, wow, this is really a great experience. And as a woman, when I meet clients going through womanhood issues, I learn a lot because I always feel that I may not be and I always feel that this is an opportunity to learn as much as I can on the job, like inside job knowledge. And some of these jobs and some of these experiences you cannot really hear, just like out there people don't talk about postpartum depression except you are on the job to learn, like hands-on training. Okay, now we have number three, people struggling with their relationships, as in ongoing conflict in the family, like family disorientation and misunderstandings, whether romantic relationships or even work relationships, especially if you're in a very toxic environment, that there's bullying, there's racism, discrimination, marginalization. Girl, you need therapy. Let's sit and talk about this and how best you can, cope with this. And then codependency issues, trust issues, difficulty setting boundaries. I cannot emphasize setting boundaries. A lot of people lack it, and I understand that it could be from an underlying trauma, or maybe low self-esteem or low self-confidence, or the childhood trauma that was more from a like was more of a generational or transgenerational dependency, as in you were taught all right? You were taught to work hard to be loved, all right? And so a lot of times, because we are from the African lineage, there is nothing like privacy. I mean, you grow up in a family and there is nothing like boundaries. Everyone's own is your own, right? And your own is everyone's own. So it becomes very difficult if you find yourself in a situation where now you want to have or build strong boundaries and you're just stuck with your porous boundaries. Okay, now let's talk more on social isolation and difficulty making or keeping friends. This is a lonely pandemic, not only for men but for women as well. It's very hard keeping friends or making friends, and so you may need some therapy to help you navigate that. And those with what traumatic history, childhood abuse or neglect, domestic violence, assault, or any form of trauma, or also PSTD symptoms like flashback, hypervigilance, and emotional numbness. You need some therapy for deep works to be done on this. Individuals with addiction or harmful behaviors. An example is substance abuse or drug abuse or self harm, thoughts or ideations and suicidal thoughts. You need therapy to help you understand why you're feeling or thinking this way. And then eating disorders or body images. Where are my girlies? Okay, we have what we call body dysmorphic disorder in the DSM-5. Okay, you need to understand that you don't have a perfect body. Okay, and an example is you not liking your nose, like looking at your nose and say, I don't like this nose, I want to change it, let's go do surgery. Okay, it's okay if you want to do surgery, but then how intensive is this? How dangerous is this, and why don't you like your body the way it is? We can talk about it in a very safe environment, non-judgmental environment. Okay, and lastly, people seeking personal growth. So when I say personal growth, I mean people who are striving for excellence, not perfection, excellence, and they want to understand themselves better. They want to work on their self-esteem and self-confidence. They would want to explore identity, purpose, spiritual questioning or existential questioning. People just want to know who they are, like when they come to ask themselves, who am I, why am I the way I am? Okay, and personality traits. So all of this means that you need therapy. The word therapy doesn't mean a mental health disorder. The word therapy means an open, safe, non-judgmental environment to talk about things that you are concerned about. The fact that people stigmatize therapy doesn't mean that you should have to wait if you're concerned about something, and you would have to try to prevent yourself, I mean, going, because you may go and meet a church member there, or a work colleague, or a family member, or a neighbor, and so you don't want them to tag you or label you. I understand, but you see, just like you don't have to be extremely sick before you go see a doctor, you don't also have to wait for a mental health emergency to seek therapy. Is that right? And you need to always understand that no matter what you do, you will always think, you will always feel, you always behave, and that's because you are a human being, and that equals to what? Mental health. It has to be balance. You have to be functional in the way you think, the way you feel, and the way you behave. Now, what are some preventive care? The preventive care all of us need to understand is that constantly we have to emotionally check on ourselves to see whether we are doing okay or not, and we also have to learn what healthy coping skills are. And a simple example is what deep breathing exercise, visualization, meditation, journaling, simple things of self-care that would help you to check yourself in balance. And if you're overly stressed, you take time to distress. We have what we call de-stress culture. You make it a part of you every day. You make it a value to always take care of your mental health. Hi, and thank you so much for joining today's first video on Who Needs Therapy on Healing Minds with Boba. I hope you have learned something, and I hope to see you again. Bye.